Thank you for tuning in to Global Elite Academy. How to open up a home care business throughout the United States. Please press like, subscribe, and share. Share this audio with someone who you may think need it. Today we're going to look at Idaho. Idaho is an unregulated state. Usually, unregulated states, you do not have to have a license for a non medical agency, and that is true in Idaho. So, we're going to talk about what do you need to open up your own home health agency. Now, if you're opening up a skilled agency, you do have to have a state license, but if you're opening up a non medical, you do not have to have a state licensing. Then you're going to figure out your business structure. So you want a liability, LLC, limited liability company, or do you want a corporation? When you figure out which one you want to do, you're going to register with the Idaho Secretary of State. File all the necessary papers to form the corporation or the LLC. Then you're going to obtain your employee's identification number, which is your EIN number. So you go to irs.gov and you can apply for that online immediately. Like as soon as you fill out the application, you can get that EIN number. Okay. Contact, like always, your accountant or whoever going to do your taxes, because they're the one that's going to be able to tell you how you should structure your business. If it should be a LLC or corporation based upon the taxes. Which would be the best way for you? Best way to open for you, LLC or corporation, based upon, you want to look at like what is your tax bracket or taxes. So contact a tax person for that. Okay. Then you're going to whatever necessary permit and license you need. Like I said, you do not need a state license to open a non-medical agency, so you won't need to get that. But do you need to obtain a general business license? Well, I don't know. If you're opening up in your home, if you're going to have an office in your home, they might want you to have a general business license. Or maybe sometimes, not necessarily in your home, it could be your office, but they might want a general business license. So you're going to check with the Idaho Secretary of State to see if you need that. And then, just like always, you're going to check with your local regulations and see, what it is you need to operate a home health agency in your home. They might have special instructions. Develop your policy and procedure manuals. You always have to have a policy and procedures. Now, the main ones that they're saying for Idaho that you need to get, you still need to get the whole policy and procedure manual, but just make sure the admission and discharge policy is included, the caregiver's qualifications and supervision, which is the standard for hiring and overseeing staff, the infection control, what is the protocol for that? And then, infection control is also under universal precaution. hand washing techniques. Hand washing is you're supposed to treat every patient as if they had a disease, and so every patient you should wear gloves, and as well as washing the hands, which that's universal precaution. Also, another thing you have to make sure is your abuse reporting. What is the procedure if the staff or the patient wanted to report abuse? And what is the procedure for your clients to file complaints against your company? So these are just some of the policy and procedures, but you want to make sure these are included in the policy and procedure manual. Okay, for recruiting, you want to make sure you're recruiting staff that are qualified to do this work, and that you're providing the necessary training. Now, at Global Elite Academy, what we do is that when you sign up for our program, or I'm sorry, Global Elite Consultant, that's our other company. When you sign up for us to help you open your agency step by step, we give you or help you get the training that you need. So we set you up with a company that has the software for all of your training. If you're doing our do-it-yourself program, you can contact us, and for an additional fee, we can also help you set up your training program, or get the software that you need for the training. Because your caregivers have to be trained or do training every year. And let's say you hire people that are not, you hire a few. It's always good to hire just a few caregivers that are not trained, that you're going to be training them. So they have to watch different videos for training. There is a comprehensive test that we usually give you after they've did on-the-job training and watch a few of your videos. You put them with a companion, which is the easier cases. And then they take this comprehensive test. If they pass the comprehensive test, 75 points or more, they'll go from a companion, which is non-experience or little experience, to a PCP, which is a personal care provider. And they need to work at your company for at least 1 year in the position of a companion before you can promote them to a PCP. Then plus they're going to look at the video training. And those video trainings, they take a test at the end of, after they look at the video, then they take a test. And then after they get through taking the test, a certification, they could just download their certification. So that's good for people. I mean, it's really good. You can hire a few people that are not trained. Now, the ones that are trained, the one that have a lot of years experience, they still have to have training throughout the year. It is required that they have the training throughout the year. They're going to watch these videos. That's the training you're giving them. Take the test at the end of the video, and then they will receive a certification. And then that goes into their file. Okay? All right, so as you can, and you should know that the caregivers have to be at least 18 years of age, have some type of training. It's just mandatory. And then you're going to also send them through some training. You have to do a thorough criminal background check on them, and you have to obtain references. You have to know that you're putting these people in other people's home, and they're relying on you to be able to, check these people out thoroughly. So make sure you do that. You need to obtain insurance, which is the general liability insurance, if and the personal professional liability insurance. And then if you're going to have W-2 employees, then you also need the workman comp insurance, which you would get from unemployment. Okay. If you're going to have 1099 employees, then you don't have to have the workman comp insurance. You're going to set up your office and begin your marketing. Now, we work with the company for marketing that he's able to get you on the first page of Google in about 2.5 to 3 months after you started. So we can, refer you to him. And if you want to contact us with any questions, go to our website at globaleliteacademy.net. Look up our phone number or our email and give us a call. And like I said, we have two programs. We have a do-it-yourself program, and then we have a one-on-one program that we can help you with. So, and then we can also connect you with the marketing person that we use. And so after you do marketing, because if you don't do marketing, you don't have a business. You have to have patience in order to have a business. In order to have patience, you're going to do marketing. And another thing you're going to do down the road after you get started and stuff, you're going to do branding. You'll merge branding in. So you'll have your own logo because you need to get your logo to start off. And then after your company, like I said, you'll get out there and get known. You'll start advertising for branding. And then you'll also get that online presence. Make sure that's the marketing. So if you're number one on Google, you'll be, that'll help you get that online presence. And then we have software that can help you with networking, getting a hold to doctors' offices, getting, a hold to the hospitals so that you can get patients from them. In order to get that, you have to sign up with our one-on-one training. We don't offer that through our do-it-yourself training. So you'd have to get the one-on-one training if you want to get that. And advertising. Well, you have to advertise to get patients. Marketing and advertising too. So yes, so that is it. That's enough to get you started. If you want to have your own non-medical home care agency. Now, as I said before, we have a do-it-yourself class where you just go online, take our class, and then after you've taken the class, then it's a form online where you would fill out and let us know what state you're in, and then we would do your policy and procedure manual, and you'll get your policy and procedure manual. And you get all that in your do-it-yourself program. And that's $2,500 for the do-it-yourself program. If you do the one-on-one program for your IHSS license, now it depends on what state you're in. So the price is going to be a little bit different. In Idaho, you're unregulated, so you don't need a license there. You only need the license for the IHSS. So you'd have to give us a call to see exactly how much it would be, but it's going to be approximately $10,500. Thank you so much for tuning in. Have a good week.